Hello, welcome to Mind Matters with Sandy and Kathleen. Again, you might notice, Sandy. However, today I'm joined by Lorelle. Hello, Lorelle.
Hello, everyone, globally.
Everyone, yes, everyone. So this podcast and video log is coming to you late on the night of the 23rd of March 2020. And we are at the very beginning of a pandemic sweeping across Australia with COVID-19. So I've asked Lorelle to join me so that we can discuss a number of things regarding mental health and how we are coping with mental health issues during this pandemic. So I live in the suburbs in Melbourne, capital city of Victoria in Australia, because I know we have a lot of overseas people that follow this podcast. And I'm in the suburbs, so I am about 55 kilometres from where Lorelle is. Lorelle is in central Melbourne. She's how many floors up?
I'm 23 floors up, facing the bay and facing Crown Casino. So I'm in the most populated area in Victoria.
Yep. So we're looking at this from two very different perspectives. Lorelle lives with her husband in quite a small apartment. So what have you got there? Couple of bedrooms and bathrooms and a small kitchen?
1.5, and I've adapted a balcony to look like,
outdoors.
So because we saw it coming, we tried to adapt and bring the greenery into here because there's no point of, there's nothing here. So you have to have something for your mental health, as you know.
Especially if you're going to spend time in your apartment, extensive.
We're spending a lot of time. Actually, we're spending probably the last 3 months or 2.5 months in our apartment because we are in a hotspot. And I do go to university, and I've been doing university online because I think it's 90% of the population at the university are international students. So that has been a major point of concern as well. So yes,
it's been a life-changing event, to say the least, hasn't it? It's definitely been a life-changing event.
For all of us, and it's for all of us.
That's right. So whereas I'm dealing with, my partner is living here and also my 6-year-old, and we have a yard. So we have a front yard and a backyard and a park out the front and a little bit of space. We have much more space in our house than what you would in your apartment. We don't live in a huge house. We live at 21 squares here. But
imagine New York. Imagine New York and the size of the New York apartment, which is quite tiny. It's the same sort of thing here, except we have an outdoor balcony that's quite small but adaptable. So if you can
you have a pet, so you have a cat. We have a dog. You have a cat. So you don't have to walk the cat, which is very good. But but you do. We get to walk the dog, but you at least have company. So as it stands tonight, the positive cases in Australia are 1,709, which has escalated quite dramatically in the last couple of days. However, we would expect that over the next couple of weeks, that's likely to become like, we'll look back on this day and think 1,709 is nothing compared to what it's going to end up as.
I'm not too sure what Johns Hopkins has got on theirs at the moment, I think, because they're quite up to date as well. But they usually are quite good. I'll let you have a look later on.
So Lorelle and I have been following this for different reasons. So Lorelle is studying international business. So she's right up with everything, the world affairs, basically, we'll call it world and business affairs. And she's dragged me into it. So I'm part of her mental health plan. So this is what we're going to discuss in this podcast is how we're coping with mental health strategies and how, even though we are in the same city, how different our lifestyles are and what we are doing to try and cope with what's going on, because it is an ever-changing environment, but day by day, things that we didn't think would ever have happened 2 weeks ago, a week ago, even 3 days ago, we are now facing things that we have never seen in our lifetime. And it brings about, I would say, a measure of anxiety. And I would expect the average person, if you were connected and listening to what's going on, that you would experience a level of anxiety about what is going on, because it's unexpected, it's unexplained, it's unprecedented, it's all of those things. And also at the moment,
I think it just come out of the blue in the last 2 weeks, and I think it's just hit them in 2 weeks of restrictions, and those restrictions have been quite brutal considering we're a democracy and we're not used to it. So that's the level of anxiety I think would be very, very high.
Absolutely. So, and differently, how our partners are dealing with it quite differently from how we are as well. So I saw that smirk then as you go, yeah, because men are quite visual. They tend to need to see it, and it has to be happening right in front of them or around them. It doesn't mean that they lack intelligence, because your partner definitely does not. He has how many PhDs?
He's got a PhD in electrical engineering, and he's also done economics. He's done a paper for the World Economic Forum.
So we're talking about a very learned individual here.
Yes, he's quite learned
individual, yeah. Articulate, intelligent, insightful, spiritual. He's got everything going on. And
he's very religious, and he goes to church every Sunday until last week, and I'm a rampant atheist. Feminist.
Yeah, so you counteract all of his good work with atheism. Yeah, so very different perspectives, but still living in the same environment. So would you consider yourself to be a planner? Are you somebody that plans things, thinks it through, likes to know where they're going? Because obviously you had a big year planned at uni this year. So so you're not working full time for the first time in a long time. You're not working full time. You are headlong into completing your master's degree with full steam ahead. You got the coal there, and you're shoveling it in at 1,000,000 miles an hour into that engine. Because we'd had discussions earlier on in the year. Do I try and work part time? Do I go to uni? So you got into the mindset that this is what I'm going to do this year.
Yes.
And then that's something, the wheel started to wobble there, and that became apparent. It was on the horizon, a good 8 weeks ago now, and you've watched it this storm come in. So how has that affected your ability, or you've, like I said, you had your year planned, and now you don't have that year plan?
It's been like everyone. It's been rough. So I planned this in December after our discussions. We had a talk. I also had a talk with Gavin as well. I've been doing this master's since 2016. So I've worked for large multinational global companies. Some might know these companies like General Motors and Cargill in the US. So it came to the...
Just so we're clear, are you the reason that General Motors has dropped the Holden brand? Was that your doing?
No, I went through the GFC with General Motors, and I understood the trouble that they had there, and I could see it coming a mile away here. I didn't think it would be so quick. I didn't think our supply chains would be so poor, but yes, I did see it coming.
So that was a time of uncertainty. That was a definite time of uncertainty compared to, and we thought that was bad. So compared to that to here, yeah, that's nothing compared to this, yeah.
No.
So how has it rattled your cage this time?
I think I'm more prepared. I think I'm more mentally prepared. After the GFC, I became very frugal. I made sure that I had all my ducks in a row with savings as much as I could. I was very diligent in the savings and making sure that I wasn't going and being extravagant. I know not everyone's got the ability to do that, but that's what I did with myself and Gavin.
You went very much on a minimalist life. After you did some traveling and looked at minimalized, like people in other cultures, and because Lorelle is quite well traveled. She's worked, because you've worked in China, like you've been to China for work, and
I've been through Asia, Europe, and the Middle East. Spent some time in the Middle East, only a small period of time. But yes, took some cultures home and have a minimalist lifestyle. I tried to do a recycled lifestyle as well, sustainable. That's how we function here. But we have the luxury of doing that as well. I mean, the daily grind is quite difficult, and we don't have any children, so that makes it a little bit easier for us to focus on these things, where if you've got children, you are more worried about the day-to-day, they're going to school, getting them educated and fed, and home into bed. So there's a different priority. We have the luxury of being a bit more philosophical about what's going on, and also preparing, I think.
So it's thrown all of your plans out through the year. So that threw you off, as you said. And so what have you done to regroup in that sense?
I have looked at all options. The university I'm at I won't say the university, it's one of the top universities in Australia. supposed to be number one, and they sent emails weekly and daily now to say, we're not sure if we're going to be going ahead. It's all going to be going online. We're a bit uncertain. We want you to go to uni, and we want you to sit with all the students, even though they're from overseas and they hadn't been quarantined correctly. So we were getting daily communication, and it was a little bit mixed. So I was hoping that today we found out that it's going to go ahead. So I will stick with university.
Because there was a concern there that you wouldn't be able to continue to study, wasn't there? For a while,
if I wasn't able to study, I've had calls from agencies to say we need supply chain people desperately because they're falling over everywhere. I would have gone back into that. I'm very fortunate that I've got a career that's quite flexible and in demand most of the time, particularly in a crisis. So that's very fortunate.
So it's do you find that reassuring in a sense that if something did happen in uni, couldn't go ahead, that you could put it off, even though you don't want to, you could put it off for 6 months? And
that was my backup plan. I had a couple of backup plans as well. So if I had no planning to me is everything. If I had no planning, A, B, C, or D, I would have been a lot more stressed than I am now. If I had
planning's part of the key, even though, and being flexible with it.
And being very flexible with your money. I think money is the main stressor for most people because they're thinking, how am I going to pay my mortgage? How am I going to feed my kids? How am I going to pay the electricity? How am I going to get through the week? So I made sure that I had practically no overheads, and I tried to make them very minimal, very minimal.
Aside from rent, you do rent there, yeah.
Yes, we rent here. Like New York, we are one of the highest pricing for real estate globally in Australia, which is quite phenomenal. We're in a bubble. So we've decided to keep our money in the bank and just rent. The apartment we're in now is probably worth about $800,000 today. I think next week it'll be a lot lower because of what's going on. But we decided to rent and just make sure our overheads were very, very low, because we either thought that it was going to be a recession coming because of the bubble and the crisis and the personal debt in Australia. Something was coming. We just didn't.
As it turned out, it was something else, a pandemic. So you got it wrong.
In January, I knew something was coming, but I didn't think it was going to be this significant, like the Spanish flu in 1918, which wiped out the majority of the population. You know,
well, that's an interesting point. You and I have spoken about sociology really quite a bit.
Yes.
And I did study sociology when I was at uni. Most of my papers were around in Asian cultures, actually, in sociology, not the Australian culture. So, but this is, and I did study, I have a degree in history, which I will say with Deakin University. I can say which my university, which I think I'm
so you can say which one, right?
I can say where it is. I've been to a couple of unis, but Deakin University, as I did this is 100 years ago, but I did look at how society dealt with it. My studies were in the Second World War, but my interest was in how society or the community changed and altered its ways and way of living for the people that were left at home. So I didn't do the who invaded what and crossed which territory and border and all the rest of it. I had nothing to do with that. I was everything around what happened with people at home, what happened with women and jobs, and how they'd slotted into jobs that were traditionally for men beforehand. All the workforce, how it changed, how people lived, how they fed themselves, how they did all of those things. So this is really, as I said, it's right up my alley. This is my area of expertise, really. Mental health.
That's why we talk so much about it daily. You know, maybe 12 o'clock at night, we're still talking about it.
We're still talking about it, and I think
talking about it, right? Because my husband's probably very grateful for my mental health companion.
Yes, that's one of the things. That's our mental health plan. That's our mental health. So I've been, Lorelle's husband has been very grateful for me that we can text in the middle of the night as this has been unfolding. So that's part of being connected has been important for you on a mental health level as well, that not just to your husband, but to a number of different people.
People globally I connect with, and I have them through Facebook mainly. I do have WhatsApp that I have a lot of Chinese people who have WeChat. So I have a lot of connections globally, only from work and also from uni. So I've gathered them in my time. And it's been good because you can actually tap into them, but the time zones do make you a little bit tired when you're trying to go news cycles for Australia and for the US particularly. It's quite draining.
So how have you gone, because we've seen a lot of people out buying toilet paper en masse, like if you're trying to get toilet paper, you could be in trouble at the moment. And a lot of things when you go into, even though the supermarkets are doing the best they can to try and restock, they just can't seem to get enough on the shelf, even though that there's restrictions on everything now. We've seen basically panic buying. What have you done to prepare? Because I know you've been quite innovative when it's come to and this is how we talk about how people manage anxiety. So probably for you and I, we manage our anxiety around the unknown by investigating, studying, and preparing. So we've both done a bit, because we're in shutdown here in this household, so we're not going anywhere. And you're basically doing the same because you're in a highly populated area where when you walk down on the street, it's hard to do social distancing because there's just everybody. So you go out later at night?
We go out around about 11 o'clock at night. There's a little Woolworths that's open. It doesn't have the restrictions near Southern Cross Station. So we go in there if we need anything that's, particular that I haven't got the supply chain for, that I didn't work out. Like chocolate. that's pretty cool for a relationship.
I know, isn't it great when you go, okay, because what we're facing here in Australia is that we're potentially, and it looks like it will happen, going into lockdown in the next week, probably. So it's the first thing on the list was chocolate. So comfort food. So do you think comfort foods?
Comfort food, just the basics. I think it was in January, my husband said that I was very prudent when I got some rice and some oil and just some frozen goods. I didn't go overboard, but I just had enough for a couple of weeks until I worked out my supply chain. And I had pretty much everything else anyway. And what I didn't have, I looked at different supply chains besides the two that we have here and got those in place beforehand. A couple fell over, so I had a couple B and C and D that I had to implement, but they've done really well. Like fruit and vegetables I got delivered today from a brand new supplier, and he's very, very good. So I'll help him out if he needs any help, on social media or anything like that. And I've also got just other basic stuff done from Bunnings or from Office Works. They will still deliver. So they have to leave it at the door because our building is clamped down because we have a lot of Airbnb and a lot of interstate people here, and we are thinking that we might have some people in the building that are in isolation. So
that's it. So you're really quite potentially in a hot spot.
Very, very hot spot.
Very much
so. We have a clean zone. If I mentioned that, I put the clean zone in a couple of weeks that you have to be prepped prior of coming into the house. The house has to be the safe zone.
Oh, yes, in your own apartment. Yes, I know about that.
Yeah. So that's from all the TWIV that we've been watching. So shout out to TWIV, Columbia University.
We've been avidly listening to a podcast called TWIV, which stands for This Week in Virology, and it's a group of virologists out of the US that get together every week. They've been going for 10 years, studying all sorts of, discussing all sorts of viruses, but obviously at the moment it's all centered around this virus.
The last 3 months we've been very keen to listen to
We've been very keen to listen to them and everything they've had to say, and we've learnt a lot. And this is where sometimes ignorance is bliss, because when you don't know, you don't be concerned. But then we are both taking this.
Some people don't know, and it actually helps their anxiety. So some people might be the types that the more they know, the better the more comfortable they feel, because it's not the unknown.
The more prepared we are as well. So what are you planning on doing if we do, which potentially it's going to happen, if we do end up in lockdown in the apartment and you can't leave there, what strategies are you going to have in place to stay in such a small environment and maintain a level of sanity?
Well, I've got some strategies. If university gets a little bit dull with my 4 subjects, it's a little bit on the dull side at the moment. I might take up something with the MOOCs from the US and Australia. It's free online courses.
Yes.
So they're very, very critical. I did a virology episode, I think it was a couple of years ago, that was great, from, I think it was Stanford. So there's a lot of free education online that you can actually do.
And you've done quite a few with Coursera as well, haven't you? Like, you've done nutrition.
Yeah, nutrition. Coursera. You can't tell, but you know, at the moment. But yes, definitely on nutrition, because my husband had bowel cancer. So I had to make sure that I was aware of what was going on there as well.
I was going to say, I think you're underselling yourself there, because he went through a 7-month bout of chemo and didn't lose any weight. And that came down to you and your nutrition course on Coursera and why you fed him. So yes, I think you're underselling it there. So
thank you.
So what you're saying is that being locked away, and I've thought this too, like, you learn a language, you can get onto Duolingo, the app.
If you're that way inclined, I've tried 3 languages. I've tried.
Have you tried English?
Yeah, I'm bad at English as well, right? So I tried Turkish and Hebrew, and I tried Mandarin was the main one.
Yes.
But I don't have that capacity to remember. So I'm more of a visual, and I'm more of a visual learning. So, and other people will be like that as well, you know.
So there's options out there for learning, is what you said, and they're free. This is the thing, you don't have to pay anything for it. So you would go for that. I don't have to pay anything.
Sorry. I'm sorry. The internet's out there. There's a lot of free, good information from universities. So I tap into that. And there's a lot of stuff from the museums. The art galleries are all online. It's a cultural smorgasbord. This is the best time to learn something while you're locked down and try to de-stress.
And what are you doing about exercise?
Exercise, I've got Gavin's weights. And we're going to do, Gavin's extremely fit. I'm not. I'm trying to get fit.
So he can't run up and down the stairs or anything.
We are going to do the up and down the stairs. I made masks today that was very interesting. So we'll do up and down the stairs. Gavin does that quite a lot anyway. He runs up and down for, I think, 2 or 3 times a day. He goes up and down the stairs for his exercise, because he needs to have good lung capacity for if he has a rebound of cancer. So that's very, very important. And he's one of the...
The bowel cancer has, we should say, the bowel cancer went to his liver and his lungs. So he has had extensive, he's been battling cancer for a number of years. So really you're living with someone that is a high risk, in the high risk category. So that brings a measure of interesting anxiety as well.
So I'm extremely pushy when it comes to, you know, touching things and cleanliness outside. I'll probably get a PSD from after this.
Just talk for a second about what you had delivered from Officeworks today.
Officeworks, I had, well, it didn't actually come today. It's coming tomorrow. They gave me an email. I've got 5 litres of disinfectant, tea, coffee. I did relent and get some sugar. I was on keto for a while, and that's just gone because I can't be doing 2 things at once like that. And I got a couple of other odds and ends and big paper towels. So I bought bulk, right? Yeah. They're quite good. It's not bulk as in I bought 50,000 toilet rolls or anything like that. It's 1 or 2 rolls of paper to make sure that the hands are clean and there's no infection. Because I think if anyone who is vulnerable at the moment and does go to hospital, it's a major risk.
That's something that you're concerned about, just a general trip to hospital, not necessarily a coronavirus trip to hospital. Absolutely.
It's an everyday, at the moment, if you go to hospital, just for anything, we're going to the oncologist in next month. So that's going to be an interesting trip as well. So you'll have to have scans and the whole thing that goes with it. But that's another thing. We think about that when it comes. You know,
so living for the day. I definitely think worrying about just today, what you need to do today. So you're doing exercise on a daily basis, basically, and it sounds like Gavin does a lot more than on a daily basis. He's doing it.
I will do more now. I'm trapped in here, and also I'm going to start a food program now that we've got a lot of stuff from the fruitfantastic.com.au. I'll give them a plug.
There we go.
There you go.
Because before you used to use the supermarkets for deliveries, didn't you? And you're walking distance to Victoria Market.
Yes.
The Queen Vic Market. Yeah. So now going to the Queen Vic Market's not really an option at this point. And so that's off, and deliveries aren't happening at the moment. So you've had to find alternatives. So I suppose the answer to this is that there are alternatives out there.
There's thousands of alternatives. You've just got to be creative. I always say to Gavin, we're like you always see the funny things with the New York subway rats and how they come in at nighttime. They've always got a pizza or something that's going on. Well, we're like that. We go out at nighttime and try to see what's available.
Yeah.
And then bring home. And then we go up the stairs if we have to. I'm going to get very fit up to this. Yeah. So you've got to be creative. Got to be creative.
Be a bit creative.
And no panicking. No panicking.
No panic. Well, I definitely, like I say, we're obviously concerned, and there's a measure of anxiety in it, and it's manifesting its way. Like, I actually feel quite comfortable at the moment because we've done a lot of planning. And if you've seen the previous or heard the previous podcast, you'll know I've talked about activities with children and also, you know, how to maintain good mental health and deal with anxiety. And I'm going to do some guided meditations, you know, I won't call them a meditation, a visualization that takes you out of the space into another space that might be a bit more comfortable. So that's that. How long do you think you can stay in your apartment before it will start to become uncomfortable?
I'm resilient. I am resilient. I have a survival instinct.
Yeah. As long as you've got a cat.
I think I've got a cat, right? So I think that I could even go on night journeys, you know, little night excursions with my I bought an electric bike. So that way I don't have to see anyone on the street. But it's actually quite funny because the city is now becoming empty because everyone has gone to the suburbs. That's another thing as well.
Yeah.
The last few days, everyone has vanished back to the suburbs and into their own homes. So, and we have no tourists and we have no students. So it's become very, very quiet, very quiet.
So far, what do you think you've learnt about yourself?
I knew this a while back, that if I have an emergency or if I have something that needs to be done that's very urgent, I will be very blunt and domineering. So to get it done. And I may not take people's feelings into account. So I've had to pull back constantly when I don't see things done how I like them to be done or how they should be done.
So you're practicing some self-recognition and adjustment.
Self-reflection is very, very big. Okay. So I have to take some time for myself and go, okay, we're in a good place. We're alive. We don't have, anything at the moment. It's good. Right. Every day is good. So
you do have things at the moment. You've got toilet paper stacked to the roof, and you've got hand towel and disinfectant. Just being
and I'm gonna go give those to my neighbours because I think that they're a little bit vulnerable. So I'm going to do a knock on the door and give them some carrots and toilet paper and a couple other things, and
So you've found that being giving is a helping mechanism 100%, as well.
100%. And I would like to also, volunteer for the Red Cross.
Yeah.
Back in the Spanish flu days, they were, they had people who were desperate to go to people's houses because they were dying in their houses. So if you're fit and you can volunteer. And when they do call, definitely be out there to give.
So we're prepared that this is going to be the long haul. Like, we're looking 6 to 9 months here.
At least. That's the first wave. The second wave is going to be the killer. We don't know because China's just going through it now, what it's going to be like.
Yeah, and their rates have started to pick up again.
Yeah, it's going to start to pick up. And we don't know how transparent our friend's going to be. So that's another thing. Is we'll have to go via Italy or the UK, because I think the UK is still in denial about how bad this is. So
absolutely. So we've got front row tickets to this. But at the moment, we both seem to be handling things fairly well on a mental level. But we are very conscious and active about that as well. And we are staying connected. So we're speaking.
But we're also thinking about those who are home alone or those who are vulnerable and don't have the finances. because we had all those businesses that closed down today, and we had 55,000 people enter Centrelink, which is our unemployment area. So that's a huge change, a huge thing. And there's a lot of vulnerable people in Australia. I think it's 80% of the country can't even get $400 for an emergency. So this is a bit of a crisis.
It is, and I had a phone call from my pretend daughter, as we call her, that my listeners know what my pretend daughter is, and she's got to write a letter to her staff. They're in a hairdressing salon. Need to write a letter to the staff to explain to them that, you know, that they're probably not going to be functioning by the end of this week. It looks like there's no chance that they're going to keep salons open. So, and that's a huge amount of uncertainty for the business she works for. She's employed. She's a salon manager, and my stepson works for that business as well. He's the 2IC. So this is both of our children, our adult children are going to lose their jobs in the same salon.
Families come together and they'll be moving in together.
Oh, well, they can't do it. It's not because that won't happen, but they definitely are looking at what they can do. Like both of them will be fine. Like there's no doubt they'll be fine financially.
I'm just saying in the broader community, you're going to have a lot more people going home and being more connected.
Like they did in wartime. It's exactly what happened in the wartime.
Right?
Yeah.
Now, a lot of European, Asian families and Middle Eastern families, they live with their relatives anyway. So we don't do that here. So now we are going to have to do it because of economic circumstances.
Yeah, things are definitely. So we know that being flexible and planning and also giving are the things, and being grateful. Being grateful, as I discussed in a couple of podcasts ago, being grateful is a huge amount when you focus on what you still have and the positives and all of those things and what your objectives are and what you have met and getting through that day, that can do a huge amount as well.
And doing stuff for others is a major thing, not just for yourself. You have to think of your wider community and the global community as well. So that is a big thing, I think, out of this whole thing, being a giving and a human being. And
staying connected as well. Because as I say, social distance does not mean isolation. It means physical isolation, but it doesn't mean emotional and mental isolation. So
100%, yes.
Connect where you can and do like things like Zoom, which we're recording this on, that we can sit here and look at each other and I suppose, you know, still connect in that way and discuss what's going on 50 kilometres apart.
Would you like to tell your audience how often we actually meet in face-to-face, Kathleen?
You've never met my son, so...
We live 20 minutes. We live, what... This is awful. It's very awful.
City. I know it's terrible, but you're not the only one that I do this with. And it's interesting. It doesn't diminish the friendship. So if you think that you have to go and sit across the table from someone and have a coffee with them to maintain a relationship, Lorelle and I are a perfect example of that. We worked together. We haven't worked in the same business for 12 or 13 years. We worked together over a decade ago, and we have stayed connected regardless of where you are in the world and what sort of job you're doing and where we're studying and where we're living. And we've gone through life events together and all sorts of things have happened.
You've had a lot of life events as well.
Exactly. And I have a friend that lives in, who I speak to multiple times a day, that lives in Sydney. It came up on our Facebook memory the other day. It's been 10 years since we have stood face to face to each other, 10 years. And yet we speak to each other. I know we speak to each other multiple times a day. I've spoken to her twice today. And we're just general life chat, and we are extremely important to each other. If there's something wrong, in a heartbeat,
I have friends globally I talk to every day, and I think if I don't have, it would be odd if I didn't talk to them, though they're part of the connection.
Part of what we are. So I am going to check back with you in like a month or so, and we'll see how things are going then. So when I check in and the ferns are dead behind you.
I'll be the hairdresser for 3 months because of the interest, right? But we'll see how we go. Apparently Gavin's good at cutting hair.
Yeah. We're going to find out, aren't we? Well, I have hairdressers in the family. They took care of me last week, but and then this is another thing. We made the decision we probably won't see each other again until after this is over. So so I probably won't see the kids, but it is what it is. We can Zoom, and I've said to my family, let's set up, Zoom, so everyone knows how to use Zoom, so that we can speak to each other. And this is about being adaptable and changing with the environment. Yeah, exactly. Thank you very much for your time, Lorelle. I appreciate it.
And thank you to everyone. Stay safe and wash your hands. That's the main thing.
Wash your hands, stay safe, look up, be kind to each other, be kind to yourself. Yeah. And we will check back again with Lorelle in a month and see how things are going.
Okay. Thanks, Kathleen.
Bye.
Bye.